Welcome back to Bay Area Focus. From behavioral health to developmental disabilities, Asian Community Health Services covers a range of concerns. Esther Wong and Pysay Phinith of ACMHS join me now. Thanks for coming on the show.
Thank you for inviting us.
So this was founded in 1974. It's been around a while.
Yes.
Yes.
Yeah, tell me about some of the services.
Yeah, this is the 40th anniversary of the agency, and we started the agency back then because of the influx of the Chinese refugee due to the Cultural Revolution in China, and they eventually end up in the United States as immigrants and refugees. And so there's a lot of adjustment issues in this new culture. And so a few concerned professionals start up the agency, start up with education and information outreach, that kind of thing. And in 1980, we started as a licensed outpatient mental health clinic. And so from then, we offer not only the mental health treatment, but we also, in 1982, we started a contract with the Regional Center of the East Bay, serving the developmental disabilities people.
So you offer a wide variety of services to a wide variety of people. I mean, we're talking about the Asian community, API, Asian Pacific Islander, but that community in itself is so diverse.
It's very diverse.
Yes.
With what? Language?
With language, with culture, with also religion as well, and also geographic location, and also as well as their status, whether it's refugees or immigrants. And that really makes a big difference in how we provide services, because if we don't understand the community and we don't know how to engage them, it's also creating a large barrier. So the services we provide, we pretty much provide bilingual, bicultural services. Many staff in our community have an experience or have a history or even understand the community, or they're even community leaders in the community that are providing these services. So there's a trust factor that's really essential in really engaging our community. So if you think about their diversity, we have, just in Alameda County alone, pretty much over 20 different API in the communities. And then with those communities, they speak, in that alone, is like over 40 languages. Because some individuals, say for example, the Chinese community, you have Cantonese, you have Mandarin, and also the village language as well, dialect. So you're talking about 3 languages in just one community.
Yeah, so you serve a lot of people.
We do.
You also provide youth services, and we have a video on that.
Wonderful.
Yes.
And I think the community organizing, when they get a chance to learn about themselves, they get a chance to learn about the political landscape, how it shapes their being and why they're in the United States, why they're descendants of refugees, immigrant families, gives them a sense of empowerment and feels like they're motivated to continue doing work for their community, but also building alliances with other Asian communities, Southeast Asian communities, Black, Latino, Rasa communities, to really feel that they have a sense of connection and struggle, and teaching them solidarity, so teaching them that to really understand their neighborhoods, their community, and feeling that they have a sense of control, their voices are heard.
And teaching that self-empowerment, that's so critical at a young age, right?
Yes.
And especially, we were talking earlier about the myths.
Yes.
And busting those myths. Let's talk a little bit about that. There are some stereotypes and generalizations out there.
There are. With the model minority myth, is that the perception is that because we're Asian, is that we're all healthy and wealthy. That means that we go to great schools, that we have, you know, our socioeconomic status is high, basically our grades are high, our health is perfect, even our mental health, there's no mental health in our family. So that's the model minority. But when you begin to start breaking it down to different specific ethnic groups, for example, the Cambodian community, the Mian community, the other sort of the emerging community that's coming out, like the Burmese community or the Nepalese community, suicide rate is really high. High school dropout rate is really high. Socioeconomic status, they're living in pretty much even below poverty level, and they're struggling in the Bay Area, or they're even struggling in Alameda County. But sometimes the myth actually creates this sort of image of the API community that we don't have any problem Yet the reality is many API communities are suffering, whether it's from health, mental health, as well as academic, as well as socioeconomic status.
And it is a myth.
It is
and
a
you are
myth.
providing those services for
Yes.
everybody in the community. So that is great. Thank you so much for coming on the show and
Thank
telling us
you.
all about it. And for more information on programs and events with Asian Community Mental Health Services, please log on to ACMHS.org. Again, that's ACMHS.org. Coming up, we'll learn all about a nonprofit that empowers Latino families to take control of their finances. We'll be right back.